Noted T-shirt model, Dr. Irwin Redlener. Hello, Dr. Doom. Good morning.
Good morning, Stephanie Miller and crew.
People commented on how handsome and romantic you looked in your Funky Cold Moderna T-shirt,
That's
Stephanie
right.
Miller Show T-shirt.
It's sad in a way, but I'm happy to get the input.
You are a fashion model, sir.
You were asking, we were saying, it really is. It must be extraordinary to you that in a pandemic that has killed, I don't know, depending on what study you look at, maybe up to 900,000 of us, that we have to bribe people to get the shot. But as Chris says, I am by any means necessary. I am like however many carrots it takes to get us to, herd immunity. But I just am with you too, Doc. We've got to have sticks too at some point. Is it the full FDA approval that is going to allow us legally to get to the part where, we can ensure the public health by the use of sticks, let's just say, as you say, vaccine verification somehow?
Yeah, I think we're going to get there. We need to get there. And it's so interesting. It's like, just a reminder, Stephanie, that people who don't get vaccinated are taking a risk, but they're taking a risk that involves not just themselves, it involves everybody else around them, which is why it's a public health, not just a health matter. And I think this is something that we have to get a handle on. It's like we require by law, and there's a big stick here, you wear seatbelts in the car.
Yep.
Now you'd say, well, in that case, what do we care? So you don't wear a seatbelt and you go through the windshield if you have a crash. We care for a whole bunch of reasons, but with a pandemic, we care for the public's good. That's what this is all about. In addition to trying to help people save their own lives.
Yeah.
That's what it comes down to.
Let's, for instance, even the airlines are starting to offer carrots. I think United is, you can download your vaccine information, win a free trip or round trip for two or whatever it is. And, other airlines are doing the same. But is it the full FDA approval? Because I just am of the, strong belief that airlines need to say you need to be vaccinated, period. Then we don't have look at all these incidents in the air of aggressive because of mask wearing. Like, remove the mask wearing, but you got to be vaccinated to get on a plane. What is that possible that could happen?
I think anything is possible. It's up to the airlines. Delta, for example, had started now filling up the entire plane. They kept for a long time. They kept the middle seat vacant. They trying to do some spacing for passengers, but no more. Now we're crowded in there like sardines again. And there's people stressed out about the mask because there's not enough regulation and rules about getting on an airplane. And it results in chaos. And these incidents of violence and attacking flight attendants are crazy, and I don't know. I don't think it comes soon enough for the airlines to really crack down on this and say, no vaccination, no airplane ride, period. That's the way it is.
Yeah, exactly.
And people will comply.
Yeah. I feel strongly that every business should do it. I think aren't these Republicans supposed to be regulating business?
Right.
You've got Ron DeSantis in Florida saying he's going to fine the cruise lines $5,000 for every person they ask if they're vaccinated because they want to keep their customers and crew safe. You have Republicans working at absolute cross purposes. Ted Cruz saying he's going to work to ban a federal vaccine passport of any kind. What? It must be so frustrating for you as a doctor and public health expert to go, why are you trying to get more people killed in the middle, as we're still in the middle of this?
Yeah, the intent is pure. It's about protecting the public's health, and it's very complicated because we go through all sorts of things about how transmissible the disease is, how to keep people safe, studies to show that masks work. It's about health, and all of a sudden it's about politics. It's incredible. I don't think we've seen something on this level before, ever.
Yeah.
At least not in my career or my lifetime, where we had polio eradicated, we had smallpox eradicated, and nobody objected to that. We just wanted to get rid of these diseases that were killing people. And we did it all of a sudden. And I think a lot of this is really Trump's fault. I hate to look backwards.
Yeah,
Steph,
it's true.
But,
He
it's like,
politicized
what the
it.
hell happened? It's amazing to me.
Well, yeah. I mean, that's, I think, there's a piece, I don't know if you saw it, Doc, in the Washington Post saying we're two Americas now. In vaccinated America, things are getting back to normal. In unvaccinated America, the number of deaths and hospitalizations are at the same level they were. I mean, but the fact that people are choosing this, that they're choosing it when they don't have to.
They're choosing it. And why are they choosing it? I have an issue of somebody in my family who I actually spent a good amount of time with last week, who is not vaccinated. Her husband's not vaccinated. And I talked myself, I was blue in the face, and I'm not getting anywhere. I'm not sure what to do.
I forgot to tell you, I offered you to my anti-vaxxer friend.
Oh God!
No! Could you he's the nicest man
You
in the world.
offered me?
Couldn't you just talk to Dr. Redlener? Yes, she's one of my best friends, and she's an anti-vaxxer, and it is.
It's beyond frustrating.
Yeah.
Tell her to call me, please.
I know. See, you're
speak to her.
too accessible like that. So, okay, like for instance, speaking of politicizing, Doc, can you explain this to me like I'm an idiot? Because I don't get the whole lab leak versus from a natural, from in nature. First of all, they were studying bat coronavirus in this lab. So whether it jumped from bat to human in a lab or what difference does it make now? The point is how disastrously the Trump administration handled this, and the fact that Trump was the only one that bought China's transparency and how well they were doing at this. So to try to politicize this now and make this into some, it's Biden's fault somehow. I just don't get it. You said we need to know the details about how the coronavirus escaped from Wuhan, China, and the role of the lab so we can make sure it doesn't happen ever again in China or elsewhere. Serious global collaboration is essential to prevent and manage future pandemics. Of course. But as usual, they're just trying to play some sort of gotcha, right? And then take the crazy up 2 levels by saying Dr. Fauci personally funded it and wanted to release a bioweapon on the world. I mean, it becomes...
It's making money from the vaccine. Yeah, no, it's one insanity after another. And I think, originally I was saying, why are we even focused on this lab issue? Let's move on and deal with it as it is. But the more I thought about it, Steph, I'm thinking we can, the lab monitoring, the lab protocols are not as good in China as they are in the United States and in Europe. And what are the problems? How did that leak even occur?
Right. If that is what happened.
Need to know.
Right.
Right. So we can't let it happen again.
Well, speaking of around the world, you said global efforts to make sure poor countries get their fair share of vaccine are fizzling out. This is a humanitarian tragedy and a time bomb for the rest of the world, who will remain threatened by new variants festering in places where COVID still rages. I mean, in some ways, it's sad that you have to go. It's in your interest, that people don't just care about other people around the world, but that it is going to affect you. That as variants fester and mutate, as you say, it is going to affect us, and then our vaccines don't work, and this goes on forever, right?
Right. And by the way, if it wasn't the case that those places were a direct threat to the United States at some point, I think we would get zero support for helping them. And they need help, and it's not just the vaccines. They need oxygen. They need medical equipment and PPE supplies. It's amazing that we don't see our globe as one big human population. It's the same thing with climate change, by the way.
Yeah.
Where it's in everybody's interest for everybody in every nation to be participating in controlling climate change. We're not that good, as it turns out, in giving fulsome support to make sure that our planet is healthy. Our planet is safe. We're so insulated. We're so arrogant about our ability to protect ourselves first and only that we're actually fighting over whether we should give more vaccine or not to India, Nepal, South America, and so on. So it's a little heartbreaking, actually, isn't it?
Yeah, it certainly is. But so back here, obviously, the president yesterday talking about the 70% of Americans, the goal for July 4th and about a month from now, right? That he wants adult Americans to have at least one shot. Are we going to get there? I mean, it looks like we're in the 60-something%, right? And obviously yesterday was about an all-out push. Do you feel like we're going to get there?
I don't know. Several weeks ago, we were doing 3 million plus shots per day across the U.S., and now it's a little over 1 million. So there's definitely a slowdown. Why? Because we've run into this profound roadblock of the anti-vaxxers who just won't do it. In some cases, communities that can't get it. But at the end of the day, we're going to have to push like hell to get to that place that he aspired to, which is 70% of people getting at least one shot. And then we have the issue of the children, of course, which we've talked about before.
Yeah.
Now 12-year-olds and up can get the vaccine, and hopefully will soon be in the 9 years of age to 12 years of age, and then lower than that. But we still have a lot of work to do, and it's the hardest work of all. The first part was easy.
Yeah.
We had the vast majority of Americans say, "When can I get my shot? I want it. I want it now." And we've almost finished with those people, and now we're to the other crowd that says, I don't want it. I'm not sure. I don't want to get it. I'm whatever the reasons are.
Yeah.
Here's where we are, the public roadblock.
So I keep coming back to this like a dog with a bone. But so, Doc, what happens when there is full FDA approval, maybe in the fall? Can this change legally? And you and I get our dream of that somehow there is some. I mean, I know you talked to Fauci and the administration. Yeah. Is there a way that things change where there is a verification system? Because I know you've warned about the chaos and state by state and fraud, and that's because you just asked us right in the break before we went on, like, how are you guys doing? And we were saying, I think we're all feeling our way because we don't know who's vaccinated or not. Like I've only gone to and I'm having a couple of very small dinner parties where I know everybody's vaccinated. That's it. And I think a lot of people are like that. The fear of going back to work, not knowing if everybody in your workplace is vaccinated, or I'm getting on a plane to go see my mom again. Don't know who's vaccinated and who's not. So what do you think? What will happen?
I think you ought to be able to know. It's unconscionable that we can't know. And I told you, I spoke with Dr. Fauci directly about this in person. And we talked about this. A lot of people who do want there to be a verification system. And then there's people in the administration who say, we're never going to do that. And we're never going to do that because we don't want to marginalize and scapegoat those who can't get vaccinated. So they can't do the activities that the vaccinated people can do. And I'm fine with that. If we say, if you're not vaccinated and you don't have a good medical reason to not get vaccinated, then you're putting me at risk and you're putting our families at risk. And I think there's no reason for us to be anxious sitting on an airplane, not knowing whether the passenger next to you is vaccinated or not. I want to know that.
Yeah.
And I think most people do. But so far, really strong resistance in the administration to develop that vaccine verification system or passport.
So with the release of Dr. Fauci's emails, I imagine your emails look the same. Like I could have written that email to you. Hey, can I use my dog's cone as PPE? What I got from his emails is he's a man of enormous patience, like you.
Yes, that he is.
Can you imagine getting 1,000 emails a day?
Yes, I know. Oh my God.
Yeah.
Dr. Doom, fantastic information as always. Keep fighting that good fight, and we'll talk to you next week.
Look forward. Thanks, guys.
Thanks, Doc.
How handsome he is in his Red Cross hat.
Uh-huh.
Wow.